Liberia is a nation of visionaries with legacy of industry and creativity. The Liberian Business Alliance is delighted to be in conversation with visionaries who are game changers in their industries. For the next 12 months, we will explore the inspiration and motivations behind their chosen discipline and how we can learn from and support them. Today, we are honored to present to you Visionaries, the Public Health Edition. For this edition, we are in conversation with Liberia-based public health professional Delou Gonsan Zeo, Deputy Program Director at the International Rescue Committee. Mrs. Gonsan Zeo is a clinician and a global health and international development professional with extensive experience across Africa, the Middle East, and Asia. She is the Deputy Project Director at the International Rescue Committee in Liberia, providing strategic leadership, technical and operational guidance for the design and implementation of a $17.8 million USAID flagship community health program aimed at strengthening the Liberian community health system to provide healthcare services in hard-to-reach areas and sustainable country ownership. Prior to joining the IRC, she was a program manager at Mercy Corps, responsible for the high-quality implementation of a $1 million plus portfolio of health programming aimed at reducing maternal and infant mortalities that reached 56,000 plus participants, exceeding program's target by nearly 150% while complying with the minimum standards of program management. Other experiences include advisor for reproductive, maternal, newborn, and child health at Save the Children UK, where she provided technical advice and support to Sierra Leone, Cote d'Ivoire, South Africa, and Bangladesh country programs and access to primary health care as the priority for universal health coverage to end preventable deaths of women and children. And now, without further ado, join our head of technology, Mr. Chris Peters, as we welcome our speaker, our visionary for the Visionaries Public Health Edition, Delou Gonsan Zeo.
Hi, Delou.
Hi, Chris. How are you?
I'm good. How are you?
I'm fine, thank you.
Great. I mean, it's been a long time. I think the last time I saw you was last year in Liberia.
Yeah.
This world is very small, isn't it?
Yeah. I bumped into you in front of your up-and-coming studio.
Yeah, I know. But anyway, thank you for accepting our invitation to be here. And I think there are a few questions I'm going to be asking you. So my first question to ask you is that what was your main inspiration or motivation for pursuing a career in public health?
I think so. My background is in nursing. And I worked in a clinical setting for a little while. And whilst there, I just felt like the entire act of clinical medicine did not suit me because I like the idea of nurturing my patients back to health, but I hated when they have to die or I had to see them suffer. So I was thinking of what else can I do that is still within the medical field, or within the health field rather, and not too far off from my then background, which was nursing. And I thought of public health because public health is curative. It's preventive rather. So I really wanted to be a part of something where people don't necessarily have to get sick to go and seek care and die or spend a lot of money seeking care. I wanted them to get the preventative messages, the preventative treatment and services that would keep their health intact. So that was my greatest inspiration, especially looking at Liberia at the time when I had completed my studies in nursing. We had just come from the war. There's loads of poverty issues, a lot of other issues, and healthcare is so expensive. So it was an idea that I was just thinking, if people can preserve their health and don't have to get ill and don't have to necessarily go in for curative services when they have gotten infected by a disease condition, that would be great. And that's how I thought of doing a master's in public health, and it has been going well so far.
Wow, interesting. So what mindset and skills are required to be a public health professional?
So I think it's key for you to be someone who cares about finding solutions. You have to be innovative, because that's the essence of public health. It is really about finding solutions, preventative solutions, mitigations, assessing the risks to the community, the general public, and trying to find a way to minimize, if not eradicate, the effect it's going to have on the general population. So if you are someone who is not result oriented, if you are someone who do not like working with your grassroots, because public health is really at the community level. So if you are someone who would rather sit in an office rather than being in the field at the community level and dealing with those issues, you are going to struggle. In terms of the skills, you have to know how to multitask. A lot of things come up back to back. 1 minute you are completing something, thinking you are about to have a break, and another is coming in a second. And also you have to have a lot of managerial skills, because you could be managing people, the finances of the project, you could be managing the entire organization. Even if you're just a project assistant, you are going to be managing your workload, your work-life balance. So you have to be an organized person. You have to be honest. Honesty is an attribute rather than a skill. Than a skill set, but I would still want to add that there, because you are playing with donor funds. You are playing with funds that will help improve the lives of the community you are serving. So you have to ensure you have all of those things, and you have to be forward thinker, because the sector keeps changing. There's a lot of moving pieces. It's trending. You have to follow the trend.
Wow. So in this case, then what are the major challenges when it comes to the improvement of the public health in Liberia?
I think so there's two sides of the coins, at least the way I see it, working in Liberia and implementing public health interventions. There's the government aspect and there's the citizens aspect. From the government part, I think we have a lot of policy document, because I work closely with the Ministry of Health. So we have, you'd be surprised, Liberia has some of the best policies out there. And we have the strategies to operationalize those policies. But what we lack is the willpower to be able to see it through. So you have these documents and they are just sitting on the shelves, collecting dust, and you have people in positions who are supposed to implement those documents. However, they are not motivated because of the low remuneration in terms of salary or lack of career growth. So a lot of things demotivate them. So from the government part, I would say those are some of the challenges. And then the investment into public health. So I work on a USAID funded project that is a public health project around community health. And a lot of the issues we are having is the sustainability aspect, meaning where the government is buying into the program and even supporting the program by investing and allocating health funds for those activities. So that's from the government end. And then our people, we come from a culture where there's a lot of myths, cultural beliefs, religious beliefs. So those things continue to affect improvement in terms of public health. A lot of the times you will be surprised. You go to these communities, Liberians, they know all of these things. They've heard these awareness messages. because public health has been going on in Liberia for years, you know, and even became more proliferated when the war ended and a lot of development organizations came in. So Liberians have heard all of these things. Go to the hospital, do this, do that, keep your community clean, do not openly defecate in the community, build your toilet, build water facility. They know all of these things. But because of either the religion or the culture or the myths about those public health practices that we are trying to bring forth to them to be able to emulate, so communities are not really helping themselves, if I may. You can take the cow to the water, but you cannot force the cow to drink. So that's some of the challenges that I've seen working in the sector from both the government and from the citizens and in terms of public health.
So I understand what it is. So in terms of dealing with large entity, what are the main challenges?
The challenges are different. There are operational challenges, there are administrative challenges, there are actual implementation challenges. It ranges from different. So I don't know exactly which one you want me to talk about. However, for an international NGO that I work for, our main challenge is working in that partnership. So everything has to be done through partnership with the community, with the county health team, the government, with other line ministries. So you have other line ministries that are operating under another mandate, and you want to collaborate with them because, for example, the issue of water hygiene and sanitation is just not about health. It's cross-cutting the educational sector, the agriculture sector, water and sewer. So it's cross-cutting the environmental sector and all of these other sectors. So to be able to get partners to come in collectively, everyone has different donor priorities. So to be able to ensure that we are all at the same table with the same mindset, that has been the greatest challenge I've seen in terms of implementing public health activities in Liberia. That coordination with multiple sectors and different line ministries is where the challenge is at the moment. There's no cohesion. Coordination is still fragmented.
So what's about challenges when it comes to funds, large funds? What are the challenges?
Well, you'd be surprised, but our NGOs have really good accountability practices. For us at the International Rescue Committee, we have our headquarters in New York, and there we go through regular audits. There are people that come down in country to do regular audits of donor funds, and the donors do their own audits as well. So they don't wait till at the end of the program. So there are different milestones of the program where they will come in and do audits, both from the donor side, both from the from our headquarters. And also there is a division at the Ministry of Health, because I implement a health program called external aid. So they are also supposed to investigate how you are using the donor funds. So there's transparency. And if there's any issue, the Ministry of Health is able to tell our donor, which is the United States government, that the International Rescue Committee has not been able to do X, Y, and Z, and we will be made to refund those funds. And it has happened before, not just to the IRC, not necessarily because of fraud or anything, but if you mismanage donor fund, if you spend donor fund on what it should not be, those costs will be disallowed, and your organization will have to repay. And that's why a lot of donors prefer to work through our NGOs. So like the project I work on, the funding, 17.8 million, is given to us as the custodian, and then we work with the Ministry of Health because we have better accountability. Not that the government is not accountable, but they are able to go to our headquarters and request their money, and we have to give it. Otherwise, we can lose our license to practice, not just in Liberia, we can lose our credibility in the sector, we can lose so many donors if one donor complains about us. So I wouldn't really say that in terms of managing large fund. In fact, this funding is very small. The other portfolio was 50-something million. And the donor, after evaluation, was happy. So that isn't really a challenge.
Well, thank you very much. Okay, so According to UNICEF, one out of every 10 women dies while pregnant, right? Now, giving birth to their babies and its likelihood of her baby dying. Now, my question is, what do you think are the main reason of or issues with maternal health in Liberia?
The biggest issue is lack of access. And I can say this 100 times, lack of access. And not just accessing the physical structure, because you may have a health facility in this community, but there can still be lack of access because of the service charge. And mind you, vast majority of the population are living below the poverty line, and they continue to sink deeper in poverty. So there's lack of access. And because of that, a lot of women are unable to access regular health services the time they're supposed to access them. And at the time of delivery, a lot of them are unable to give birth in a health facility. So a lot of them are giving birth in the communities. So when there's complication, the time it takes for you to get that person to the nearest health facility, sometimes the woman loses her life en route to that area, and the baby as well. And so that aspect was just about in case you have a health facility nearby where the fee for service is huge. But there are communities that are more than 5 kilometers away, that is more than 1 hour away from the nearest health facility. And that is just for someone who is not unwell, someone who is fit like yourself is more than an hour away. But for a pregnant woman, a woman in labor, or small child, it takes 2, 3, 4 hours walk to get to the nearest facility. So mind you, this woman is in labor and she has to walk those miles to get to the health facility. Sometimes she, gets complications along the way, or sometimes she gives birth there and there's issues. So the lack of access because of the poor road network, lack of health services at the community level, causing distances between the communities and the health facilities, and then the lack of access because of the fee for service charge. Those are the leading causes of this amount of women dying in Liberia, and I have seen it over and over and over again. And that's what our project is tackling, trying to tackle bringing services to the people at the community level to minimize the distance between the community and the nearest health service, health facility.
So don't you think the ambulance will be another factor?
You'd be surprised. There are communities in Monrovia, well, not Monrovia, in Liberia that have ambulance, but the maintenance of it. So, and that's the thing, in implementing public health activities, you have to think of sustainability. So if the government have a lot of the county health teams, because the Ministry of Health is decentralized. So in every county, there's a Ministry of Health or it's 4 county health team. So the county health teams, most of them, almost all, in fact, I can say this, all of the county health teams have ambulance. However, they have issues with the vehicle maintenance. There's no money, operational fund to maintain the vehicle. And the maintenance is not just from repair, but also buying the petroleum product that it needs, and also paying for the ambulance driver who works 24 hours. So those are some of the challenges. So it's not that the ambulance is not there, but they are inadequate, they are limited. So you see a county maybe with maybe 1 ambulance or 2, and that county is massive, like Lofa County. The ambulance might take almost 10 hours, well, 10 is an exaggeration, 5, 6 hours from one point to another point to go and pick up a patient who's very critical. So the whole road network is really exacerbating these things. So the ambulance services, yes, is still a challenge. We need more ambulance services, but then what's the sustainability plan? How are you going to maintain it? Because there are counties that have ambulances packed because they cannot fuel it to go and get patients from those locations.
Thank you. So now, the Minister of Health in Liberia, Dr. Wilhelmina Jala, affirmed that Liberia achieved universal health coverage. does Liberia actually have the means to facilitate that?
Absolutely. Absolutely. Any country can achieve universal health coverage. Universal health coverage is just about ensuring the last person at the very remote community, the most marginalized person, gets health services. So any country can achieve it, but it requires political will. And that political will make that precedent to ensure that funding are allocated for health, not just allocated, but spent. So that means building more health facilities in communities that I talked about it earlier. There are a lot of communities that the nearest health facility is more than 1 hour walk away for an unwell for a well-bodied person. So building more facilities and also equipping those facilities and also investing in primary health care, which is what this project I worked on does, in showing that there are services at the community level. You and I know that in the UK, we go to our GP. So those services we access over there is primary health care, is community health care. That's all it's about. When you don't feel well, you go in and you get to be seen by someone for little or nothing. In the UK is nothing, you know, but over here, the fee for service is so high. So once the government starts to invest into primary health care, ensuring that there are free healthcare services for citizens who cannot afford, we can definitely achieve universal health coverage, because it's not impossible, but it requires political will and investment, financial investment into the health sector.
So why do you think public health is important for the economic development of Liberia?
I've said it in so many ways during this interview. First of all, Liberia came from a war, came from nearly 15 years of war, and that in itself really destroyed everything, including our economy, infrastructures, and a lot of Liberians are struggling. And there is something I need to make clear in this interview. Whenever you seek health care and you have to pay a fee for service, it reduces your family income. Last week, my daughter got ill and she was admitted, and she was just discharged 2 nights ago. And I paid $280. And even paying that money, I was upset, but I could afford it. There are people who cannot afford that. Imagine someone that is earning $150 or earning $100, $75. Those are real salaries, I'm telling you, for people monthly. And you have been stamped with a $280 bill because your child was in hospital for 3-4 days. You have not just used your salary for that month, but you have even gone in deficit. So every time a family that is already poor and struggling, living below the poverty line, spends more than 45% of their household income on seeking health care, it takes that family deeper into poverty and it sustains them there. That's why public health is important to the economy, because when people have those awareness messages about good health-seeking behavior and practices, and there are these public health services at the community to prevent people. For example, I know I keep coming back to my program, but it's a very good example for this discussion. The program I run, we work with community volunteers. We call them community health assistants. We train them to be able to administer paracetamol, to be able to test and diagnose malaria and treat for malaria at the community level, to follow up on pregnant women and ensure that if there's any danger sign, to refer them to the health facilities, to treat children under 5 for those killer diseases like pneumonia and diarrhea that kill children every day in Liberia. So we work with the community members who would designate someone that we train, and we provide them these medications and equipment. And every day between the hours of 7 a.m. and 12 midday, They go across their communities to make rounds. If anybody there has any of those signs and symptoms, they treat them free of charge. Free of charge. What that is helping those families in those communities we are working in is to preserve their little income, to not be able to spend it on fee for service at the health facilities. And that is helping families to gradually but increasingly maintain that income to be able to use it on other things like sending the children to school, providing meals, buying clothes for them. Is helping those families to not slip further below the poverty line or deeper into poverty. So these are the kind of projects that we need that will sustain communities, and it will help boost the economy. Well, maybe boosting it is an exaggeration, but it will help maintain the economy in a sense. Because public health is less costly. Basically, the essence of public health is less costly compared to curative medicine. Just as preventative.
Wow, thank you. So now, what can the Liberian business and community do to improve public health in Liberia?
The business community?
Yeah.
One of the things we've been saying is getting the multi-sectorial approach to work. A lot of the times people think it's one sector's business. No, every sector needs to be involved into public health because public health affects all of us. So we need people from the private sector, the public sector, and within the private sector, we are talking about those businesses. There's something called corporate social responsibilities. So for example, you have your studio. You should find a local NGO or a local civil society organization and be able to get a tax waiver from our LRA to be able to give percentage of your tax to those organizations to be able to implement public health activities in your community, especially if you are contributing to public health hazards. So there are businesses that trade in petroleum. Those things affect our water sources, and it causes infections and disease for the communities, for children. Gas stations, radio stations, TV stations like yourself, whatever business you find yourself in, you should be able to at least contribute, if not even a percentage of your tax, but to be able to meet your corporate social responsibility by giving something annually to an organization that works in the sector to be able to support their work to sustain and improve public health. Because it's everybody's business, and that's the multi-sectoral approach.
Once again, thank you for joining us on the conversation about the public health and business, which is very important. We have learned a lot tonight. Please don't forget to join the Liberian Business Alliance. Our website is www.liberianbusinessalliance.org.
Zena made a bang.